to 3DCon Scientific Committee, Dr. G. Vijayakumar, and my regards to all the senior professors on and off the dais. I've been given a task of talking to you about millets in the next 10 minutes. I'll try and do a bullet train of this.
Meenakshi, please stick to 10 minutes time.
Yes.
Because we are behind schedule.
Yes, sir. Sure,
and I have
sir.
to catch a flight.
Sure, sir. So it's a known fact that colonization led to lower prevalence of diabetes, and repeated invasion by Arabs and Mughals in India, followed by the British colonization, led to impoverishment. That could be the reason why there was lower prevalence of diabetes post-colonial independent India. And it's not a secret that every time you eat or drink, you're either fighting a disease or feeding a disease. The elegant study, the START study, I don't need to mention to this audience, but the fact is that though we have diverse diets, but still there's a systemic review which tells us that 41 different dietary patterns in India have carbohydrate as the main component. And this study was published, this is a paper published in the European Journal of Clinical Nutrition by Dr. Anup Mishra et al. In Jan 2022, according to which this data has been obtained from What India Eats, ICMR 2020. In this, they had found that in urban India, about 6 regions with 16 states, and rural India, 4 regions and 10 states were studied in 2012 and 2016. According to ICMR 2020, the prevalence of diabetes in the urban India was 25% and rural India was 7%. Why? We need to see that was there a difference in the cereal type of consumption, the type of carbohydrate, quantity of carbohydrate, the accompaniments which they were consuming. Yes, the urban population, it was found that they were consuming more of rice and wheat, and rural was cereal and millets. Now we have the data which tells us that, the data which tells us that in urban and rural India, the consumption of carbohydrate is as high as 83%, 86% in rural India. Urban India, again, it is on the higher side, as high as 77% and 81%, both in the eastern and southern part of the country. Now, what is the difference? If you see, the macronutrient intake is high in urban Indians, but even higher in rural Indians. And look at the stark difference in carbohydrate intake. It's 368 grams in rural India in comparison to 289 grams in urban India. Their protein intake also was much higher in the rural India. But look at the carbohydrate type. It was more from millets, and the protein mainly came from lentil carbohydrates, that is the whole grams and the pulses. So that's the variation. And we know very well all, whether it's ADAR, SSDI, ICMR, all the guidelines talk to us between 50 to 60% of carbohydrate of your total energy intake. But there is emphasis given that it should not only provide the carbs between 50 to 60%, but the carbs should be complex carbs and they should be more nutrient dense. So now this gives us an idea that where does millet sit on our plate? You know, whenever anybody talks of millets, one equates millets only to ragi. We have 8 types of millets. In 8 types of millets, we have major millets and minor millets. In the major millets, we have ragi, jowar and bajra. The remaining are all minor millets. Now, if you look at millets, the calories are between 306 to 348 calories per 100 grams. They provide protein between 8 to 12 grams per 100 grams. They provide fiber as high as 8 grams. And not only that, you will also see that they are a source of polyphenol, phytosterols, tannins, phytates, avanthramides, lignans, calcium, iron, phosphorus, copper, potassium, low in sodium. But mind you, the calories are almost equivalent to that of the cereal, wheat and rice, except for that they are micronutrient dense. They are a source of fiber. But there are certain other plus and minus which I'll go a little later on also. Now when we talk of millets, if you look at the proso millet and the foxtail millet, they are a super bumper source of protein which give us satiety. They are also a source of fat, but the best in the lot, I would say, when it comes to glycemic control, we have the 3 millets, that is the barnyard millet or the gudravali. Then we have the bajra, and third is the foxtail millet. These 3 millets, I would call it to some extent, they are glycemic friendly. Though there are papers associated even with kodo millet, which has a very, very high GI among the list of millets. So we have the GI between 42.3 to as high as 64.6. So that's the range of GI for the millets, from starting from barnyard millet, going to foxtail millet, pearl millet, 42.3, 54.5 and 56.6. Now if you look at the pearl millet, they are also source of phosphorus, iron, carotenoids, fiber, carbs. They also contain magnesium, which also helps not only in blood sugar control, also in blood pressure control. Now, as I mentioned to you, the finger millet, which is the most commonly associated millet which one talks of, it's very, very nutrient dense. But remember that the GI is 61 plus. So it's not a low GI. So people are used to taking ragi dosa, and ragi most commonly is consumed as a porridge, either as a kanji or as a kali. And they take it as an early morning drink. They start their day with millet porridge and then they take their breakfast. So these sort of things worsen the glycemic control. Now look at this paper. This was published in Times of India, which said millets in market may up the sugar level. What is the reason for this? We all are talking, it's rich in fiber, it's rich in prebiotics, it's got fructooligosaccharides, so all this should delay satiety, it has got protein. Where is the problem? This is another paper talking similarly, saying that all the millet based foods are high in GI. Now, as I mentioned to you, the GI is ranging between 42.3 to 61.1, 65.4, I'm sorry. Kodo millet is the one which is the highest in the lot of millets. The reason being, a study was done by MDRF in 100 stores, among which 48 brands showed that they were polished. So if you're going to go to the market and buy millets without knowing whether they are polished or not polished, the purpose of buying millets is lost. And look at the polished millets, they truly look like pearls. They are not the dusty, ugly, micronutrient dense grains. So there was another study which was done by Dr. Mohans with about 7 subjects with finger millet, and they found that the response, glycemic response, was not any different when it came to white rice or finger millets. But then there is another review paper which was published in December 2022, which did say that we all are aware that there is enough and more evidence to tell us that when we choose on plant-based diet, when we choose on foods which are low in saturated fat, trans fats, or healthy carbs, complex carbs, they are beneficial to the gut, and invariably they improve systemic inflammation and insulin resistance. Then we also have a paper talking about all the processed cereals with reference to millet-based cereals, especially the ragi. When you compare it with the rice-based cereals, you find that the fiber content is much higher. Now this is the recent data which is being published by ICRISAT, which is a systemic review of 80 studies, 80 studies, 1,000 subjects, and 11 countries, and 11 different varieties of millets and different methods of processing. And the minimum days has been 7 days to maximum duration has been as high as 2 years, and they moderately, they have found on an average, they have studied this between 3 to 6 months. What did they find? They found that there was a dip in the blood sugar level by 12 to 15% in those who were persons with diabetes, both in the fasting and postprandial. They also found that from the diabetic state, they moved to the pre-diabetic state. From the pre-diabetic to the non-diabetic state, there was also a dip in the HbA1c by about 15%. Now they saw also that when you cook a millet in water, in comparison to white rice, they find that even the boiling of water, there is a difference in the glycemic response with reference to millet. Then there is another paper which tells us that it's not only the millet per se, polished, unpolished, it's the form, the processing, the pre-preparation, and most importantly, the accompaniment with which you consume, which has an influence on your blood sugar level. Now I would want to make a mention here that not everybody is aware that millets are goitrogenic in nature. So they need pre-processing. You need to either roast them, sprout them, ferment them, or prepare them like how we prepare our idli and dosa, and only then they should be consumed. They should not be directly obtained from the market and pushed into your preparation without the pre-preparation. So roasting, either fermenting, roasting, sprouting, or fermenting overnight does the magic. Now we all know that we don't only live with HbA1c or a fasting and a postprandial, we are also worried about glycemic variability. So we say that there is some research to tell us when you add on fenugreek seeds or whole grams, which are the lentil carbs, they play a major role in lowering the GI of the millet preparation further down. Now, this was a small AGP which was done about in 2015, wherein I had used varaga for a patient. It so happened that the patient had consumed varaga against white rice and chapati. Though varaga is nothing but kodo millet, which is the highest in GI in the entire list of millets, but glycemic variability was much better. This is another paper by Ganga Hospital wherein they found that rice-based idli, the GI was much lower than the other foxtail, barnyard, small millet, pearl millet and kodo millet. This is a foxtail millet paper which talks to us about improvement in diabetes, dyslipidemia, also improves blood pressure. And this is another paper which talks about 50 to 100 grams of millets used in 900 subjects which did improve the lipid profile. And there are several such papers, but the beauty of millet is it can be used in all your type 1 patients who have celiac disease without altering their blood sugar control. And there are certain anti-nutritional factors in millets which need to be worried about. They are the tannins, phytates, oxalates, amylase inhibitors, cyanogenic glucosides, which can be improved by soaking, germinating, fermenting and popping. Most importantly, they are a source of copper, vitamin K, potassium, so they need to be restricted in those places, and you cannot give it to those people who are having GI disturbances or obstructions. So guidelines are choose on those millets which are not polished, and we need to do some studies to find out if we can have more millets with more of amylose and less of phytates. Thank you for your patient listening.
Thank you.